Yeah, Ilya already made the introduction to part of the company. We are a company of 5, 6 very seasoned serial entrepreneurs. So we have done 3 times the race and the journey from startup to 500 million value. And we have a number of very good experts on all the fields what we need to run this company. Ilya has already mentioned motion is getting important for medicine. So you see by the EU is funding with 50 million a consortium to look into this. Roche is making the 2nd annual digital biomarker company. You could see also Big Pharma has interest in this, but only 5% providers. This gives you a hint that there's really a good chance for a good market. Ilya has already told you the story. The story is that the latest technology advancements in sensors and in software make it, of course, possible to move the gold standard from the lab to the real life, to only a fraction of the cost. And this is how it looks like. So whenever you move, you make flexion, extension, any kind of direction, and the speed of motion, you get outcomes like this, for instance, during a therapy, before therapy, in the therapy, after therapy. And we came across SenMotion and thought it was a brilliant idea to combine this spine sensor with the insole sensor. You have seen already this. And because this enables, with both devices, permanently long-range measuring, very high accurate measuring, and then come to part 2 of the story. Part 1 is having gold standard sensors in reality, in real life. But part 2 is even more important, is making sense out of the data. Of course, you have the real-time feedback to the patients, but when it comes to medicine, it is unfortunately not that easy. You cannot simply even bring everything to the patients. There is strict and clear regulation, and this is good. There are good reasons for this regulation. So we have quite extensive experience in building big data health solutions. 20 years ago, we made the standard databases for the Human Genome Project, and we registered the first German big data solution as a medical device. So with this data solution, we create 3 specific outputs, strictly root-based and to data protection laws. Once for the patient, once for the healthcare professional, and of course also for sponsor or payer. And with this, we address now the 4 relevant markets. The pharma industry, as I've said, the upcoming hype here really is motion biomarkers. And we are in contact with nearly everybody from the big pharma industry, and they have very big interest in this. And we intend to form another pre-competitive database with early access to the regulators to get that through. In the healthcare setting, Ilya has also mentioned what you can do with the insole. So you can do very big beneficial things, saving money for the healthcare system in terms of hospitalization times, in terms of reoperation rates, by really controlling the process rather than just put 5 kilo on your leg the first week, put 10 kilo on the on the second week after a TAP surgery. In the occupational health management, we have thousands of professional drivers who are running around with back pain. They have 30 days sick leave and 41% back pain. So everything that can contribute bringing this rate down is not only good for the patient, but also good for the health, for the general system. So we are in the planning of making big clinical studies here to bring down this rate of for about 25%. And needless to say, this setup can also be used in performance improvement and injury prevention for marathon or golf. And all of these markets are very, very big, as you can see. So despite the Withings or the Fitbits who come with a gadget and then try to go to the medical side, we clearly come with the expertise from medical industry, from medical devices, from big data in medicine. And this is the picture then that naturally also will bring you to the idea of an exit scenario for the company. So we have put altogether 8.2 million into the story so far, privately, without any investors, and we're looking for 25 million in a Series A. We are very good on the way. We have big support from the US and US finances, so we will see some complementation from the European side. And of course, we will use it to finish all the setup for clinical studies and for market development and penetration. As I said, we're doing a rollout in the US at the same time. Yeah, and last but not least, the benefit, of course, is for the individual and the saving cost of the healthcare system. We are convinced that we can once again bring a 3-digit million benefit to the investors and aim to have solid revenues in the order of 80 million after 5 years. Thank you.